WTIM mobile app and Amazon Alexa is your ag information station with over 8 hours a day of agriculture programming and our own local farm broadcaster. Tune into WTIM, your ag information station.
WTIM. And this is the WTIM morning show on your information station. It's sponsored by People's Bank and Trust, where they put people first, and Landmark of Taylorville. I'm your host, Reed Kamai, and we know that February is American Heart Month, and so now's a good time to bring in the folks at Taylorville Memorial Hospital. And with us right now, we have Michelle Kilduff, a registered nurse at Taylorville Memorial Hospital. And Michelle, thanks so much for coming in.
Thank you for having us.
Yeah, it is an absolute pleasure to have you in. And you're here to talk a little bit about the cardiac rehab program. I know folks think a lot about their heart health and getting cardio workouts. But in terms of cardiac rehab, talk a little bit about the program in that area at Taylorville Memorial Hospital.
Okay. Our program is for our cardiac patients that have had certain diagnoses happen, certain events. We see mainly the patients that we see are those that have had a heart attack. They've had open heart surgery, whether that's bypass surgery or replacing a valve. Those that have stable angina or chest pain, we see those. Then also anybody who's had a cardiac stent where they've had a blockage in their heart and then they've had a stent placed, we see those patients. And then we can see patients that have had a heart transplant. We have had at least one of those, if not two. And then we see some patients that have LVADs in placed, and that just helps, increase the output of their heart. Then we also see congestive heart failure patients and those with peripheral vascular disease, or we have a PAD program, peripheral artery disease. But those patients generally, as long as they come in within 6 months of the event, that is all covered by insurance. And they come in and exercise for 3 days a week. We see our patients Monday, Wednesday, and Friday. We're there from about 7 to 5 p.m. We have morning classes and afternoon classes, and those are just appointment times. Those patients are there for about 45 minutes to an hour, and it's always monitored exercise. Those patients always have a nurse with them, a registered nurse that is ACLS certified, and our nurses in our program, we are CCRP. We have gained that certification with AACVPR, so we have went one step further to better understand and get better outcomes with our patients. But our patients come in and exercise. Like I said, they start out with warming up a little bit. They usually do anywhere from 5 to 10 minutes on a machine. And it is tailored to their needs. Not everybody is going to get on a treadmill. Not everybody is going to be able to do this machine or that machine and get their heart rate up, get that exercise in, because maybe they have a hip replacement. Maybe they have a knee replacement that just is bothering them on a certain machine. We tailor their exercise prescription, as we call it, to their needs. But we definitely try to get in about 30 minutes for sure of exercise in that hour. If we're not able to do that, and every patient comes in at a different activity level. Some are not used to any activity at all. They're very sedentary. So we tailor their exercise prescription to where they're at then. And then we are hoping that we can get them, to where they tolerate more exercise, that they do fine while they're exercising. We monitor their heart rate, their blood pressure, their heart rhythm. If we have any issues with any of those, we might either have them stop, slow down, let them recheck a blood pressure, recheck the heart rhythm, and then if it needs to be addressed with the doctor, then we contact their cardiologist or their primary care doctor and see what we need to do. We definitely, we're watching them the whole hour while they exercise. We're listening to them. How does this feel to you? Are you having any pain? How, are you more short of breath? Do we need to adjust something? So how do you look on the heart, on the heart monitor, it's basically a continuous EKG they're getting while they exercise. So we're able to detect any arrhythmias, especially ones that need to be reported immediately. There are definitely those, and we've definitely seen that happen. And then, we make a call to the doctor, and sometimes they even need to be transferred to the emergency room to get, further care. And sometimes they come in and don't realize they have a problem like that, or they don't realize their blood pressure is extremely high, and we need to get that down. You have a patient that's had a heart attack, a recent open heart surgery with the bypasses, well, our heart, doesn't like high blood pressure at all. But when you've had these recent conditions, we want to, decrease the workload of the heart. Yes, you're going to exercise and increase the workload, but it's monitored and we're able to see how they respond to it. Are we getting a better outcome for them? Is their blood pressure going down? Generally after that 30 to 50 minutes of exercise, many patients can get up to 50 minutes of exercise. And after that, normally we'll see their blood pressure come down, but we go by how they feel.
By how they feel. And
yes.
and I appreciate that very in-depth overview. It gave me a lot to respond to. So how many nurses do you have who have the certifications to work with patients in the rehab?
We have two, myself and Kim Kersey. Okay. We have our AACVPR certification for our program, and that same, company offers the certification for the cardiac rehab. And we decided, it was a couple years ago, yes, it was in 2024, like, hey, we're going to get that national certification as well. So we had to study, we had to, study some more and test out. And we were very blessed to be able to get that certification.
So just the two of you. And then now you mentioned at one point you used the word classes. Yes. to describe, what some of the rehab patients go through. So like how many people, I almost said students, are
Yes.
in these classes as part of their rehab?
Okay. Those classes are kind of like their appointment times, but
Okay.
That's generally about an hour long, the sessions. And we have it can range from anywhere from a couple to around 10 or maybe like 7 to 10 in our gym area. Now some of those might be phase 2 cardiac rehab patients and some might be phase 3. Generally, we do not have any more than 5 phase 2 cardiac rehab patients to one nurse. So, we can have up to 10 phase 2 cardiac rehab patients as long as we have 2 nurses. So the phase 3 are a little different. They got a little different rules.
Yeah. Now I imagine that if you're trying to watch multiple patients,
Mm-hmm.
with everything you described about how
Yes.
cardiac rehab works, right? We're not talking about an external body part. We're talking about the heart. So
Mm-hmm.
I imagine that's a lot that you have to pay attention to, right?
Oh,
because then if something goes wrong, you got to step in.
exactly. And like there's been, and me and Kim work well in that respect. One of us could be watching the monitors. One of us is out and about checking blood pressures while they exercise because, everybody's got to get their blood pressure checked before they even start. Then we do it while they exercise and we do it at the end. But we're always in sync with trying to figure out, okay, where do they have to go next also? And we're really trying to make sure that they get as much exercise as they can.
Yeah.
All of us are just as guilty of, if I tell you you're done, like, oh, okay, I'm ready to stop. If she says I'm good to go, I'm good to go. Now we're really trying to, get them to incorporate more exercise if they can. Now, obviously, if they're not able to, they're not able to. But that's it. We work well in sync with keeping our eyes on them while they exercise. Our desk, we're able to watch everybody in the gym. And we've had a few instances where I know, because I've seen that patient long enough, that, hey, something doesn't look right with them. And I know in one situation that person got sent to the emergency room, and so and that's the great part. We see these patients up to 3 months or 36 sessions. And we get to know them very well 3 times a week, Monday, Wednesday, Friday. As long as they come regularly, we get to know how things are going.
So you said 3 days a week for the 3 months. So,
Yes.
and you also said that it's covered by a lot of health insurance policies, which is certainly big for, having that many consultations, because, those costs, can add up.
Yes.
So that is an important thing there. You mentioned phases.
Yes.
Talk a little bit about the phases, and then I think we'll be at a good point for the break. But go on.
Okay. We have 3 different phases. Phase 1 is always in the hospital, like generally, or like an outpatient center where they've maybe had a cat or they've had a stent placed. They're in and out. But that's when the nurse just talks to them after their event, usually the day of or the day after, and talks to them about cardiac rehab. They discuss risk factors, stuff that, the patient needs to maybe start thinking about, what can I change to improve my cardiac health? Then phase 2 is us, and it is where they come in and it's monitored exercise. Like I said, again, it's always with the nurse present. We are always watching their heart rate, their blood pressure, and their heart rhythm. If any of those is not right to begin with, they don't exercise. But in our phase is where we, like I said, monitor all that. And then we're able to do a lot of education on the risk factors of heart disease, that they can change, that they can work on. Then we have phase 3, which is for our phase 2 graduates. And once they've completed phase 2 and we feel like they are appropriate to go on to basically independent exercise. Now it's right along with us. So we still are there to assist them in if they've got any questions, if they think something's wrong, but they monitor their own blood pressure. They're not monitored with the telemetry or the EKG reading, and they know that. And that is a little different in the aspect it's outpatient pay, but obviously if we feel like, they're a great candidate for it, we always offer it to them at the end of the 36 sessions. And those 36 sessions may take a little bit longer than 3 months. We make sure they get them. And then once they're ready to go to phase 3, we offer it. And not everybody takes it, but we've had quite a few lately, many that are like, yeah, I want to do it. I want to keep going.
Yeah, so that's a layout there of the phases from Michelle Kilduff, a registered nurse, a registered cardiac rehab nurse at Taylorville Memorial Hospital, joining us here. And let's take a break. And when we come back, we'll expand on this very in-depth conversation about cardiac rehab. This is the WTIM Morning Show on your information station.
Your information station, WTIM.
Hi, this is Julie Sanchez with People's Bank and Trust. Hola, mi nombre es Julie Sanchez con People's Bank and Trust, and I am here to share information about our Save by Spending program. Save by Spending, round up, where we round your debit card purchase to the next dollar and put that change in your savings account. Also, our Save by Spending rewards program. You can earn cash back on all qualifying signature-based debit card purchases. Call 888-PBT-1954 and learn more about Save by Spending programs. At People's Bank and Trust, we put you and your savings first. People's Bank and Trust, member FDIC, equal housing lender.
As we huddle down for hopefully the last blast of winter, don't yawn your way through February. Cozy up to huge February savings at Just Beds. Get $100 off any size Sealy Posturepedic Patterson Ultra Firm or Pillow Top mattress. Let us cure your tired nights and groggy mornings with $200 off a Sealy Posturepedic DuPont Soft, Pillow Top, or Hybrid mattress. Sleep better, feel better, yawn never with Just Beds. With free delivery, setup, and removal.
Just Beds.
Taylorville Care Center's personalized therapy program helps you get back to enjoying the season. Whether it's holiday gatherings, winter walks with the grandkids, or cheering on your favorite team indoors, we'll help you stay active and independent. You'll receive great medical care and the therapy you need to get moving again. If you've been in the hospital or just need a little boost, call Taylorville Care Center at 824-9636, 824-9636. Taylorville Care Center, caring for our community for over 50 years.
This is Dwayne Wheeler, the police chief of the city of Taylorville. As a law enforcement officer, I've seen the impact that depression and suicide have on many people. Many times, those contemplating suicide endure considerable suffering and distress, but there is help. If you feel depressed or lonely, There are many resources to help you. You can call a trusted relative, friend, or minister, or call the Suicide Prevention Lifeline at 1-800-273-TALK. That is 1-800-273-TALK. All of us are here to help you. Thank you.
Hi, I'm Mark Sanders, and I'm your longtime host, interviewing Shelbyville and Shelby County community and business leaders every week. For some 10 years, WTIM, your information station, has originated its Friday morning show live from our downtown Shelbyville studios. Tune in on AM or FM or online every Friday from 8:40 to 10, brought to you by these great sponsors.
Family Drug, the Villas of Hollybrook, Shelbyville Manor, and Corner Copy sponsor the WTIM Shelbyville Morning Show.
Take charge of your mental well-being with the new Credible Mind screening tool from the Christian County Health Department. Get fast, confidential insight and connect to local resources that fit your needs by clicking the CCHD banner at TaylorvilleDailyNews.com. Empower your health today.
Here's Dr. Pavi Gill from Springfield Clinic, Taylorville.
Lifestyle medicine is about motivating you to improve your quality of life by changing habits and behaviors.
Find out more by clicking Dr. Gill's icon at TaylorvilleDailyNews.com.
WTIM.
This is the WTIM Morning Show on your information station. We're sponsored by People's Bank and Trust, where they put people first, and Landmark of Taylorville. I'm Reed Kamai, and I continue my conversation with Michelle Kilduff, a registered nurse in cardiac rehab over at the Taylorville Memorial Hospital. And we've been talking all about cardiac rehab and the process that goes into that. And it's a very timely topic, of course. February is American Heart Month, and so heart disease is something that you folks over at Taylorville Memorial Hospital look into a lot, and you've got plenty to talk to us about that. What are some of the risk factors and other things people should know about it?
There's many different risk factors. We do tend to cover each of those. Every week we have a different risk factor that we address with all of our patients. Like on Mondays, we'll show a video. Wednesdays, we give out handouts. And then throughout the week, we leave it open for discussion. But, what we really focus on is, high blood pressure. That's a silent killer. It can damage your blood vessels over time. It does, lead to cardiac disease, quicker if that high blood pressure is uncontrolled. We look at high cholesterol. What's their diet like? Let's reduce your saturated fats. Let's get your cholesterol level where it should be. Is your statin working correctly? We look at diabetes, is your blood sugar running in a normal range? What is your last A1C? Is it less than 7? We talk about, all the different things that they can address with diabetes. We also look at being sedentary, lack of exercise. Exercise is one of the first things that we put on the back burner. If the doctor says, take your blood pressure pill, you take it, but when they tell you to exercise, you're like, that can kind of wait, but exercise affects all the risk factors, for the better, like it just improves them. And then we talk about smoking, that is it still is a leading cause of preventable death in the United States. It's very harmful to all the blood vessels throughout the body, and especially the heart. We look at stress, what stresses you may not stress somebody else, but chronic stress is very hard with the heart. And we talk about different ways to deal with that. I'm very different than you. What works for you is not going to work for me. But the same can be said about high blood pressure. What works for one person, blood pressure pill, is not going to work for another. And that's where seeing somebody 3 times a week, we can address that risk factor. And they can see personally how exercise takes down their blood pressure, how it lowers their blood sugar, and normally will do that. And it's going to lower your cholesterol level when you exercise. Might help you quit smoking, go for a walk rather than smoking a cigarette. But, all of those risk factors, lowering your sodium, we talk about from week to week. And like I said, it's a nice informal area where everybody can ask questions. We promote questions, and once somebody gets to talking, normally another person might think about another question. And then before we know it, we have a good group discussion on different risk factors, and like, hey, or how can I prevent this?
That's
like,
right.
So it's a great space for, once you get one person to talk about it, they all chime in.
No, that is lovely, and that is actually perfect timing because we're just about out of time with Michelle Kilduff, a registered nurse in cardiac rehab at Taylorville Memorial Hospital. Michelle, thanks so much for coming in and providing all that valuable insight.
Thank you.
And stay tuned, more of the WTIM Morning Show coming up soon.
With SRN News, I'm Rich Thomason in Washington. President Trump is suggesting that federal agents enforcing immigration law could be a bit more gentle in their duties, using a softer touch, as the president puts it. He also says it was his idea to withdraw hundreds of federal agents from Minneapolis. The search for 84-year-old Nancy Guthrie is now in